So thank you very much, Mark, Katia. Um, Let me start with a quote from our former Chief Medical Officer, Sir Liam Donaldson, who said, "If you always do what you always did, you will always get what you always got." Now, with the pandemic of not only COVID, but also of diabetes, we clearly need to change the way we move forward. We have a global epidemic at the present time, and as you see here, approximately 500 cases across the world. In my country, 5 million. Recently in Pakistan, very frightening figures, and other countries from the Middle East. Here's a paper from the former chair of the MENA region of IDF, Pakistan, 26.4%. More than 1 in 4 adults in Pakistan has diabetes. Here's a study in 2018 from Venezuela, closer to home in this region. This is a population-based study in 3 regions in a relatively poor country and going through major problems at present. Look at the high prevalence even in this country. Brazil, I know, is much higher. Type 1 diabetes increases as well and continues to. This study is from Finland, which has the highest incidence. But here's a study recently from the United States looking at the annual prevalence of diabetes in children, pediatrics, rising from 1.8 to 2.8 per thousand. So we're seeing an increase in both major types of diabetes. And we have what we might talk about as a diabesity epidemic, diabetes and obesity. It's an underrated global public health problem, as outlined by a former president of IDF and my good friend from Melbourne, Professor Paul Zimmet. We need to think out of the box, looking at new risk factors, maternal and child health, and so on. So we have a battle, a war. And as you know, in the course of any war, there will be major battles, regional, national, global. And we can talk about the First World War if we look back. It was just over 100 years ago, we were remembering the end of one of the worst international conflicts ever, the First World War, which, as those of you who are interested in history, of course, was triggered by the assassination of Archduke Franz Ferdinand of Austria in Sarajevo in 1914. Look at the casualty numbers, which were horrendous. 17 million lives lost on the battlefield, 4.25 million per year. But look at these statistics, which I say are equally startling. It is estimated that in recent years, perhaps up to 5 million deaths are attributed to diabetes annually. Again, before World War I, there were many warning signs which could have prevented the pathway towards conflict. Similarly, with diabetes, there are many warning signs, yet the epidemic continues to spiral. And look at this very sad example of the largest ever McDonald's opened in the world was outside the London Olympic Park for the Olympic Games in 2012. So there is an urgent need, global need, for policies that promote prevention, early diagnosis, and effective management of both type 2 and type 1 diabetes. So really, the message for governments and the world at large is that we cannot afford to ignore diabetes because the costs, human costs and economic costs, are too great. Look at in some developing countries, up to 40% of the healthcare budget spent on diabetes. A lot of this is due to the late complications, which are silent in the early phases, but can be screened for. So as my good friend Ronald Maher and colleagues from Hong Kong wrote in Diabetes Care, that this is a rising global public health tsunami. I used to, until this year, lecture a lot all over the world, including many times in the beautiful Brazil, and Colombia was being mentioned too, where I was fortunate and honored to open the first ever diabetic foot clinic in Colombia, in Bogota, in 2009. But this was when I'd just been lecturing in Calcutta, and I picked up the paper on the plane, the Times of India. And the headlines of the domestic pages: "Stop the hard sell of sugary drinks, sugar-coated danger." This was an open letter to the chief executives of Coca-Cola and Pepsi-Cola in India, reminding them that the prevalence of diabetes had doubled within 12 years. Can we educate our politicians? You may think that's a rhetorical question, especially if you had the misfortune to watch the debates between the two candidates in the United States. You may think it's impossible. But in Mexico, surprisingly, you may think, but they were very successful. They put a 10% tax on sugary beverages. So far, so good. But in Denmark, you may have thought they would have done well, but their sugar tax failed. They dropped it. In Berkeley, in California, 25% tax 2015 led to major reduction in sales. The UK, very conservative, lethargic. It took them years of talking, and they eventually instituted this a couple of years ago. So there is some hope here, but taxes must be accompanied by other policies, such as city design. For example, living in Miami for many years, it's safer to drive because you're likely to be mown down if you try to cross the road. So we need to look at city planning. Can we have cycle tracks, encourage walking, and so on? Now, I was very fortunate in one of my many trips to India a couple of 2 or 3 years ago to share the stage with Narendra Modi, the Prime Minister of India. And he got up in Bangalore and said, the biggest threat to our survival in terms of health is no longer malaria, tuberculosis, infectious diseases. It's non-communicable diseases like diabetes. And of course, he was right. But now we're facing a new challenge, and that is that the COVID pandemic is going to swing attention back, and sadly, it's already happening from non-communicable to infectious diseases. So we've got a major challenge. So I could ask you, is diabetes the cancer of the 21st century? We can learn a lot. I'm not criticizing our colleagues. We need to learn and emulate our colleagues in cancer. And there are similarities. For example, screening of high-risk groups is effective. Long-term remissions are possible and cures now. That's certainly true of type 2 diabetes. Increased public awareness has been effective. Now, fear arousal is a very delicate topic, and I'm not promoting this, but it has been effective in cancer management. Why does someone go for a prostate check or a mammogram? Because they're frightened of cancer. So fear arousal has not only been successful in increased engagement, but also in large raising sums for research into cancer. So there are similarities, and we could learn, but I think talking to my friends who are clinical psychologists, they would not advocate fear arousal. So we need to tread carefully and find a route for better education. Let me give you a couple of case histories. Here's the first one. Male in his 60s goes for routine screening, high PSA, prostate-specific antigen. Transperineal biopsy, prostate cancer confirmed, scans clear. Hormonal therapy, then brachytherapy, then external radiotherapy. What's the outlook? Cure. Ladies and gentlemen, I can tell you that was me. I had a routine test 2.5 years ago, high, always repeat a test, high. I went through all that. My PSA is normal, I'm fine, I'm cured. But what's the response? Even my medical colleagues, oh my God, that's terrible, you've got cancer. Terrible, what can we do to help? But look at this case history. This could have been me. Someone of the same age, routine screening, glycosuria. Further tests, type 2 diabetes. A bit of neuropathy, a bit of protein in the water, but normal kidney function on tests. Diabetes treated with medications, outlook no cure. Already got early complications, and a significantly reduced life expectancy with these minor complications. What's the response that patient gets? Oh, don't worry about it. It's only a touch of sugar. My grandmother had it. She was 90 and she was fine. We've got to change the approach to make diabetes recognized as something we can really prevent and treat early on, prevent the complications. But if it goes on, it's a very serious condition. Here's a person with diabetes writing last year in a supplement to the Sunday Times of London. He, like that past history, found out he had diabetes, but he said this, he wrote, cancer is serious, heart disease is serious, but diabetes didn't feel serious at all, and now I only have one leg. That's a person with diabetes writing. And our data, and I've just come from a 4.5-hour clinic, which was a little late this morning. These are our data in a teaching hospital, patients on dialysis. If you're on dialysis and you've lost part of a foot or a leg, 3 out of 4 patients don't make it for 2 years. I would put it to you that this is worse than most forms of cancer, and therefore we must take diabetes seriously. But like cancer, diagnosed early, can be cured, can be prevented even in diabetes if you catch people with impaired glucose tolerance and so on. So 21st century diabetology, I would put it to you that prevention is the key. If one is diagnosed with diabetes, then blood sugar control, up to date, accessible, consistent, and screening for complications of the eye, the kidney, the heart, the nerves is absolutely vital, because the first symptom of eye disease can be loss of vision if you don't have screening, but it can be prevented. So lastly, the COVID-19 pandemic is having a major impact on non-communicable diseases. And these are from an article by the editor of the British Medical Journal just a couple of months ago. This pandemic has led to a neglect of many conditions. Cancer care and heart disease were emphasized here, but no mention of diabetes, which in many ways is more common and even more preventable. The British Medical Association has emphasized the need to tackle a backlog of non-COVID treatments, and positive improvements must be maintained. At last, we're seeing a little bit of reduced bureaucracy, which is a major step for mankind, video consultations and so on. But look at the risk for people with diabetes. 1/3 of COVID-19 deaths in the UK in hospitalized patients occur in people with diabetes. Older age, poor glycemic control, other complications predict poor outcome. So we must look after our people with diabetes and help them to maintain good control, and also psychological support. If they're shielding at home, it's very stressful, and that impacts glycemic control. We need a parity of focus on all types of diabetes, which of course needs the attention it deserves. So let me leave you with a couple of quotes from the book of Ecclesiasticus in the Bible. It reads, chapter 18, verse 19, if you're really interested. Before you speak, learn. But before you fall ill, take care of your health. And this is true for people with non-communicable diseases, especially during this pandemic. So lastly, from Enrico Fermi, before I heard your lecture, I was confused. Having heard it, I am still confused, but at least on a higher level. And I hope that does not apply to you. Muito obrigado, muchas gracias.